All right, so our next caller is asking, it is important for me to explore my options for financing a full dental implant. Can you provide information on whether Medicaid or any other dental insurance plan might help with the expenses?
So, what this caller is asking is this caller needs a dental implant and they want to know the expenses involved in the dental implant and whether if a Medicaid plan would help with the dental implant or any other dental insurance plan can help with the dental implant. So, if you do not have insurance and if you are thinking about getting insurance, my recommendation is whichever agent that you are talking to, talk to them and then see whether the plan that you are going to get and is going to help you receive a dental implant. You can give them even the codes, what we call it as a CDT codes or the dental codes. You can get it from your local dentist and you can check with your agent whether that is going to be covered. And the most common thing people forget whenever, particularly if you are going to get a private insurance, which means like you do not work for somebody and you do not work for a company, you do not work for a corporation, then you are going to get a private dental plan. There are always going to be waiting periods and there is always going to be what we call it as a missing tooth clause. So if you happen to miss a tooth prior to getting the procedure, prior to getting the plan, they are going to deny it under the plan. It's almost like a pre-existing conditions, what we call it as in the medical world. So you're not going to receive the dental implant under the plan. So the short answer is check with your agent whether they are going to cover the dental implant and not going to deny it as a pre-existing condition or under the missing tooth clause, and whether they are going to still give you the dental implant without any type of waiting period and whether they are going to cover it. That is one. And then Medicaid does not approve for the dental implants. That is my short answer. From with the limited exposure that we have to the Medicaid plan, and I can tell you Medicaid says that you do not need a tooth, and particularly if you are missing one tooth and if you do not have any other severe medical complication, they are not going to approve you for a dental implant because Medicaid says that you do not need that extra one tooth to be able to chew. So you are not going to be covered under the Medicaid plan, I can tell you that. And going back to your first comment about being able to afford afford the dental implant, the dental implants we normally say they cost anywhere between about $2,500 up to like about $4,500 or up to $6,000-7,000 if you are going to need some type of advanced bone grafting. So to get a dental implant, if it is going to be in the range of about $2,500 to about $3,000, you can receive those dental implants as low as about $99 per month. And Lynn, you are the specialist and you talk to the patients about the payment plans that we have. Can you explain briefly so they can understand?
Yeah, we use a few different banks that we go through for patients to have interest free for certain periods of time. Um, and that helps them fit it into a monthly budget. Like Dr. Vadaville said, you can get them as low as $99 a month, depending on the amount of money that you're requesting from the banks. And we have one company that we use that actually is doesn't require any kind of a credit check or anything. So there are ways to get this done if doing a full payment, in full of 25 to 4,000 is not an option for you. There is ways to get it done where you can fit it into a monthly budget for yourself and make it comfortable for yourself.
Fantastic.